A family doctor is a doctor of the family, a first contact doctor, where every member of the family, irrespective of age and gender, you can say from womb to tomb, they have access to a family doctor. He would, by training and his aptitude, his or her training and aptitude, would be working as friend, philosopher and guide to the individuals and families attached to them. We had some 60, 70 years ago, all doctors in India after passing out MBBS were working as family doctors because there are no specialty boom. All doctors were working as family doctors and they were looking after all the problems. In fact, the healthcare scenario, at least the treatment aspect of it would have been was really good at that time. After some time, because of lack of policies, every doctor started going for specialization, and now there are only specialists and no family doctors left in India. And this scenario is a unique situation in India alone. We don't have family doctors. People do not have a choice now. They are forced to go to hospitals, do doctor shopping to get their health problems addressed. We do not have family doctors. People tend to go to different doctors for each problem. For a chest pain, they go to cardiologist. For a headache, they go to neurologist. This kind of activity does not happen in any developed country with a good health system. Since India does not have a good health system and people are allowed to go doctor shopping and we do not have family doctors too, and finally people end up having over investigation, over treatment, over hospitalization, and the health disease care expenditure is increasing every day, which will not happen if you have enough family doctors. The challenges in India to promote family doctors is, first of all, nobody knows what is family doctor. Nobody knows what is the need of it. So we need to create awareness on that. That's what I am working on. I try to create awareness on what is family doctor and why they are needed. And the challenges are so many actually. And as such, the people are treatment oriented. They do not know the importance of public health also. The doctors who work as family doctors are the ones who has insight into public health issues, because health is a byproduct of so many public health initiatives, and these insights are got only by the family doctors. A specialist sitting in the hospital is unlikely to have insights into the social issues because his work is focused on certain areas. So because we do not have family doctors, our healthcare and public health is actually going in a different direction, and an irreparable damage is being done by lack of having family doctors in India. In fact, I had been visiting several countries just to see how the health system is working in other parts of the world. And first I began with the UK. When I went in 2007, I found the family doctors, they are called GPs, they were offered more salary and more recognition. It is difficult for a MBBS doctor from India going there to become a family doctor because their students wanted, by choice, they wanted to become family doctors. They are given honored and they are given more salary and recognition. And at that time it was £5,000 for family doctors, when a specialist got only £3,500. Such a huge difference was there. Naturally, doctors wanted to become family doctors. In Canada, 60 to 70% of MBBS students willingly take up family practice as their first choice, and the remaining people only go to specialities. In UK, things are under private control. Still, 40% of the doctors still become family doctors there, though everything is in private. In Sweden, Denmark, Australia, everywhere, the family doctors are looked upon as most important doctors, and a certain number of people or families are attached to them. In Denmark, I found that maybe around 5,000 people are attached to each family doctor, and for all their problems, they will go to that particular doctor only. And only if that doctor refers, they have opportunity to visit a specialist. In Cuba, I found 250 families are attached to one family doctors, and they even make home visits every week. Like that, everywhere, family doctor is the most important doctor in the society, and they are important for looking after the health of the people, promoting health, preventing disease, and for early diagnosis, and to offer comprehensive, continuous, holistic care to each individual and families attached to them. This is an absolute essential thing that India has to follow. The way forward is to we have now around 1 lakh MBBS seats, and government is increasing the specialty seats, and it has reached up to 50,000 of 60,000 maybe. Still we have 40,000 MBBS students wandering, and all these 40,000 students are joining the fresh batch of 1 lakh MBBS students and competing for 50,000 PG seats. In fact, they waste all their time in the entrance coaching centers, and we don't have family doctors. So we need to train the remaining 50,000 or 40,000 MBBS doctors who pass out every year to become competent family doctors. MBBS is not enough to practice as a family doctor. Even in the past, when all doctors were practicing as family doctors, MBBS was not enough to make them competent to work as a family doctor. But they naturally got the opportunity to work as a family doctor, and by 5 years they became very good family doctors. The current scenario is different. The students join the medical college without any insight into what a family doctor is. Their only objective is to become specialist. They somehow focus only on entrance coaching, and they come out after MBBS. At that point, they have absolutely no insight into what is a family medicine. They have no clinical skill also, which are necessary for the family doctors. So they need 3 years intensive training after MBBS. These 40,000 students who do not get an opportunity to get into specialty seats, they can be trained to become competent family doctors by offering 3 years training. You have DNB family medicine program, or we can start MD family medicine in all the medical colleges, which is much more important than starting specialty courses. Every medical college should have a family medicine MD course to get recognition. That has to be implemented. So it has to work at policy levels, and the doctor's mindset has to be changed by teaching the students on the importance of family medicine. And the Department of Family Medicine is a must in all the medical colleges to go forward.